Patient deterioration rarely happens all at once. Most patients show small changes hours before a crisis, but those changes are easy to miss during busy shifts. Machine learning exists in healthcare to help surface those early warning signs before they turn into emergencies. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. Many nurses hear the term machine learning and assume it involves coding, complex mathematics, or replacing clinical judgment. In reality, machine learning in patient care is designed to do one thing well: analyze large amounts of patient data continuously and identify patterns that suggest risk earlier than humans can under pressure. Think of machine learning like a smoke detector. It does not fight the fire. It does not evacuate the building. It simply detects danger earlier than the human senses can. Nurses still decide what to do next. The system only draws attention to possible problems. At the bedside, machine learning systems monitor trends across vital signs, lab values, oxygen requirements, medications, and patient history. A slight rise in respiratory rate, a subtle drop in blood pressure, and a change in mental status may not seem alarming individually. Together, they can indicate early deterioration. For nurses, these systems act as a second set of eyes. An alert may prompt reassessment, closer monitoring, or escalation of care. The nurse evaluates the patient, confirms whether the concern is valid, and decides on appropriate action. Machine learning supports awareness, not authority. Understanding limitations is critical. Machine learning does not understand context the way nurses do. Pain, anxiety, movement, or equipment issues can trigger false alerts. Nurses must use clinical judgment to interpret alerts rather than responding automatically. In real healthcare settings, early warning systems powered by machine learning have reduced unrecognized deterioration, rapid response calls, and ICU transfers when used appropriately. Success depends on nurses engaging with the system thoughtfully instead of ignoring or overreacting to alerts. The nclex and modern nursing education emphasize patient safety, technology awareness, and escalation of care. While exams may not mention machine learning directly, they test the same principles: recognizing early changes, reassessing patients, and acting before instability becomes critical. In practice, nurses who understand how machine learning works are better equipped to trust it appropriately. They recognize patterns earlier, communicate concerns clearly, and advocate for timely intervention. Technology becomes a partner rather than a distraction. Machine learning does not replace nursing intuition. It strengthens it by highlighting what deserves attention first. Nurses remain responsible for assessment, decision-making, and compassionate care. Now that you understand how machine learning supports early detection of patient deterioration, the next step is exploring how digital systems and data come together in everyday nursing workflows. That broader picture lives within nursing informatics, and that's exactly where we'll go next here at the Learning Studio.